Welcome, everybody. We are so happy to have you here with us. So come on in and start to join us. You are here for the Chronic Illness Disability Town Hall, and we are so honored to have you here with us. Let's see if we've got the chat going. Very exciting. Okay, so we have a couple of things to get started until we're all here. And the first thing is we want to do a little icebreaker, true to form. The question, let me also say here, we have some amazing people here from our disability and chronic illness SIG, and they have on brand, always have a would you rather icebreaker. So in the comments, please leave the answer of would you rather have human-sized chicken legs or would you prefer your lower half to be an octopus legs? Go ahead and leave those there. All right. So while we're waiting on those, let's see. All right. Before we get started, I'm just going to do a couple of announcements. This is really important, just a little bit of housekeeping. So let's get going with that. This live stream is educational and is not intended to replace therapy. For treatment-related questions, please work with your provider or contact a local clinician. You can use the IOCDF's online resource directory at iocdf.org/find-help to locate a trained clinician near you. The International OCD Foundation is not a crisis hotline. If you are in crisis or if you're ever feeling suicidal or unsafe, please go to your local emergency room or call 911 or the 988 Suicide Crisis Lifeline by dialing 988. You can also access it online by going to www.988lifeline.org. We want to create a safe place, so please be kind and respectful to everyone. At the end of the day, we're all just here to support one another. And a note that this is being broadcasted on several social media platforms and is being recorded. So before we move into some awesome questions, I'm actually going to read off the bios of the wonderful people we have here today. So first of all, we have Mary Walters. Mary Walters is passionate about treating obsessive compulsive disorder and related disorders, especially body-focused repetitive behaviors, panic attacks, and severe phobias. She takes a special interest in working with clients who present with harm OCD and POCD and uses ERP and ACT to help her clients live shame-free and fulfilled lives. She also enjoys working with the LGBTQIA+, polyamorous, and neurodivergent communities. Mary lives with a chronic illness, disability, and OCD and is passionate about accessibility to care, advocacy, and living life shamelessly. Mary has also given talks through the OCDRI and the IOCDF conference and college level trainings. So welcome, Mary. I'm going to go over it. Next, we have Jake Winchester. Jake is a licensed professional counselor and licensed addiction counselor with a private practice based in Parker, Colorado. Jake has been working as a counselor since 2016 and in community mental health and emergency room settings and specializes in OCD and anxiety. Jake has lived experience with OCD since the age of 12 and lives with multiple sclerosis since the diagnosis in 2009. Welcome, Jake. We also have Jessie Birnbaum. Jessie has a bachelor degree in psychology from Wake Forest University and will attend the School of Social Work at Boston University in the fall. She has had OCD since childhood and started experiencing chronic illness symptoms in early 2020. Since then, she has been diagnosed with a host of chronic illnesses and a rare disease. She works with Rare Youth Revolution and young adult rare representatives to advocate for those with chronic and rare diseases. She co-founded the IOCDF Chronic Illness Disability Special Interest Group and helps lead virtual meetups for the IOCDF Young Adult Special Interest Group. Welcome, Jessie. And last, we have Sandy Robinson. Sandy has a master's degree in literature and is a current library and information science graduate program candidate. Sandy was born with a physical disability and chronic illnesses. She has had OCD since she was a toddler. Sandy co-founded and co-facilitates the Chronic Illness Disability SIG with 3 other panelists. She is passionate about how chronic illness, disability, and OCD intersect and how to make ERP accessible and just. So thank you all for being here. I think we can all agree that we have 4 incredible panelists here. So let's go back and see what everyone has to say. Terracotta Chabada says octopus legs because I could learn to multitask so much better. Agreed. Someone said, come in, come in and I hear is octopus. I can imagine that was a little bit concerning to start. Someone said, I think I'd like to slither around like an octopus. Definitely octopus. I'm constantly juggling. Excellent. And that's it for today. All right. Would we agree? Let's start with you, Mary. What would you say?
I'm always team chicken legs. And everybody else always does octopus. I don't know why I'm team chicken legs. I just think it's funnier.
You'd look cute in jean shorts.
Thank you.
Yeah. Sandy?
Team octopus, because I love the water and I can move in every direction.
Agreed. How about you, Jessie?
Octopus for sure, 100%.
Very cool. And what about you, Jake?
I'm also going with chicken legs. I grew up on a farm and I know how fast they can run too. So
I think I'm team chicken legs too. There's something about their cute little feet that just make me very happy. I love that. Okay. So thank you for that icebreaker. And what we're going to do here is I'm going to encourage you guys. You can leave your questions as we go. We're more than happy to try and include your questions as we go, and I'm going to be asking some questions to the panelists today. So first of all, let's start with you, Mary. Why is this topic so important for us to discuss today?
Oh, that's a great question. Chronic illness and disability themselves are something that are not talked about enough in various forms of media, and even in working with Sandy, Jessie, and Jake at the SIG, having to start up the SIG and even carve out this place for ourselves, there's always more work to be done and there is always more to be said. Additionally, from the clinician side of things, it has a huge impact on the therapeutic relationship and the work that we do in the therapy room in OCD treatment. So just being able to say, here's the OCD, here's the chronic illness and disability, neither of those exist in a vacuum. They're both always overlapping. So the reason why it's so important to me, right, is to be able to help clients figure out what's what, how it works together, and what we can do about it.
I love that. Thank you so much. And I can't agree more. Jake, can you share a little bit about why this is important to you specifically?
Well, Mary had a great answer already, so I don't know how to follow that up. But I think it's just important because there are so many chronic illnesses that are kind of, like the hidden illnesses or hidden disabilities that people talk about, that people don't really know what's going on with anyone unless they're willing to talk about it. And then once you talk about it, the stigma also comes along with it. And, the stigma, I think, is just something that we have to constantly fight against, whether it's a visible disability or invisible disability, that it's just really important to kind of bring it up and also continue to fight for accommodations. Accommodations is a dirty word in OCD, I guess, but there's a certain thing that you have to keep fighting for it, and you have to keep making sure that people have access to the things they need.
Yeah, and quickly, can you share a little bit about the term accommodation when we're talking about chronic illness and disability? Because I think it is an important word for those who are struggling. Would you mind sharing?
Sure. I'll just use a personal example. When I was working in community mental health, I had to kind of go through the whole paperwork process of getting virtual like remote time approved. Because of my MS, I deal with a lot of fatigue. And so having a day or two working from home helped a lot with not having to do the commute, that kind of thing. And I was still able to do my job, still able to, function, but having that time to rest and not commute and not have to be in the office was really helpful for my recovery period during the week so that I could actually do what I wanted to do.
Yeah. Amazing. Yeah. And I think there is we use the word accommodation with OCD as if it's something we want to reduce, but in the lens of having a disability or a chronic illness, it is very, very important. So I love that you brought that up. Sandy, would you mind sharing why this topic is so important to you?
Yeah, I mean, disability and chronic illness are often hidden a lot of the time, but they're really common, and they're common as you move through the life course. So the chances are, if you're not disabled or chronically ill, someone someone who's close to you is. So I think it's really important that we understand this sort of piece of diversity. Isn't a bad thing. It isn't a superpower, just like a neutral part of human diversity.
Right. And Jessie, so good, Sandy. Thank you.
Yeah, I mean, I think even going back to what Jake said with like accommodation is a dirty word in OCD treatment, I think, especially for me, there's been so much overlap between my chronic illness and my OCD, which is part of why we started the SIG, because when I would try to find like chronic illness support groups or try to understand other people with chronic illness, my OCD attached so much to the chronic illness that I almost didn't even relate to them. But there's so many people I know. I even see Elise in the chat said something about like having an OCD therapist who didn't really get it. And there's just so much overlap that I think it needs to be talked about more in that sense of really understanding and parsing them out.
Agreed. Yeah. And Elise did say at 4:09 California time, said, I felt I had a really big disconnect from an OCD therapist I had who did not understand my chronic illness in addition to OCD. I ended up switching because of it. And I think that that's a huge reason. Thank you so much for that comment, Elise, that we're here today is hopefully to really help people understand, as Jake said, some of the stigma that's also attached here. It's not just weeding out the two, but looking at that. I'm actually going to thank you so much, Elise, for that comment. Let's just talk about this month. This month is Disability Pride Month. I'm wondering if any of you, and whoever wants to start, wants to talk about what does Disability Pride mean. Actually, let me take that to Sandy. Could you give us a little understanding about what does Disability Pride mean?
Yeah, so I'm from Canada, but in the States, this week actually was the 33rd anniversary of the Americans with Disabilities Act, which is federal law in the States that has really inspired a lot of different laws internationally. And I know in Canada, it's really inspired the laws here. But basically, a whole bunch of activists worked very hard for a long time to gain, basic accessibility, things like, accessible toilets, accessible schools, like no longer having segregation in schools by ability, that kind of thing. And so it's been 33 years and there's been a lot of progress towards accessibility and making the world a lot more accessible and inclusive, but there's still a lot of ways to go. So it's about celebrating the activists who came before us, but also looking towards the future, what we can do to make the world better.
Amazing. Yes, it's very exciting. I'm so happy to see that we're having this. All right, so let's move to really getting to the depth of the overlap. I know most of you are all a part of the SIG. Let's talk about the overlap between OCD and a chronic illness. Are there any? What has been your experience? Would you like to share, Jake?
So I wrote out like a bullet list because I was trying to think of like, well, what is actually happening here? Some of the things that popped up as the overlap are like, they're both often misunderstood. They can both be in remission or near remission. By themselves, they can be disabling, right? Whether it's OCD by itself or chronic illness. And it's also a very exclusive club that I wish would stop handing out memberships.
Yes, I do agree with that for sure. And actually, we've got some comments saying, like, in the lens of OCD as a disability, I think that that is very true. I mean, we do understand OCD in and of itself as being in the top 10 most disabling medical conditions, not just mental health conditions. So I think we really can't wrap our arms around the whole community as they handle one or both. How about you, Mary? How do you see the overlap between OCD and chronic illness?
In so many ways. I often see that with both chronic illness and OCD, that they are very secretive. Oftentimes, people do not want to share the depth of their OCD symptoms and the way that it debilitates them on a day-to-day basis. Same thing with chronic illness and the depth of what's going on there. And especially when seeking healthcare, or actually lack thereof, being unable to seek out healthcare resources, going to either a therapist who is unfamiliar with the ins and outs of chronic illness and disability, or going to a doctor who is unfamiliar with the ins and outs of OCD, we see this disconnect and also this ping-ponging. And I've definitely been someone who has been affected by this ping pong of, in the one instance, the therapist says you need to seek out medical attention. And then the other instance, the doctors on your medical team say you need to go to therapy. And then that just bounces the person back and forth. And one of the reasons, even echoing back to what Sandy said about disability pride in this whole month, is that it's so important to be able to normalize your experience and the aspects of your disability that are, or chronic illness, that are often purposefully hidden out of that desire to be secret because of that shame or that embarrassment.
Right. Yeah. And I think too, there's a shame layer over both, surrounding both of them that is so strong, right? Like no one has anything to be ashamed of for having either, but they do so strongly come with shame. There's so many cultural views of how you should be and how your body should look and how able you should be. It's also with OCD. So I can completely agree. Sandy, do you have any additional, overlaps that you're aware of between OCD and chronic illness?
Yeah, I think a lot of it, as other people have talked about already, is that it's hidden. A lot of the times, OCD can be really invisible, whether that's through a mental compulsions or, you have some kind of disability or chronic illness that doesn't seem apparent to most people. So I think, it's just remembering that everyone's experience of chronic illness and disability is really valid, even if we can't see it.
And Jessie?
Yeah, for me, what's really challenging is I have a lot of health anxiety. So then it's tough to know, like, do I go to the doctor? Like, is that compulsive, or is that going to be dangerous for me? And just a quick example, I have a really bad cold. I'm on day 6 going strong. And I wasn't going to go, my mom's like, oh, go to urgent care. You should get tested for COVID. And I was like, oh my God, I should get tested for COVID. And I was kind of freaked. And then I kind of waited it out. And I had some bug bite. I ended up going into urgent care. And they're like, oh my gosh, this is infected. Why? Sorry, it's getting kind of gross. But they're like, why didn't you come in sooner? And there I am walking in so proud that I'm on day 5 and I hadn't gone in yet. And was freaking out about COVID and strep, but waited it out, saw I didn't have it, and knew that it was actually okay and not compulsive for me to go to urgent care because I had waited and I wasn't doing it out of urgency or that compulsive state. But it is really hard to know whether it's OCD or whether it's chronic illness, even in just that small circumstance, but in a lot of other circumstances in my life.
Right. Yeah, agreed. People are coming. I feel this so much. This is so relatable. Great topic tonight. I think that we're touching on a larger population than we even know about. We know the statistics of OCD, but I actually think a large degree of people with OCD are struggling in some degree. So that's why this is so awesome that we're covering it. Okay. This is actually, I want to dedicate some time to this because I think it's so important. What do you wish people knew about individuals with chronic illness? What do you wish, how could, we're here to spread education and get them to know. What do you wish that they would know? Sandy, would you like to go first?
Yeah, I think the first thing I would say is that if you know a person with a chronic illness or a disability, you know one person with a chronic illness or disability. Just because someone is chronically ill or disabled doesn't make them any less of an individual with like desires and weird quirks and things they like about their life, things they don't like about their life. So, we got to remember that, yeah, it might be a big population that is either disabled or chronically ill, but at the end of the day, everyone deserves to be treated as an individual with like respect and dignity.
Right. Agreed. I want to go in. I forgot to mention to you guys, I am Kimberly Quinlan. I do not have OCD, but I have a chronic illness of my own since 2018. If I can go here, just because I can barely hold my tongue. One thing I wish people knew about individuals with chronic illness, to speak from what you're saying, Sandy, is your Uncle Joe's treatment doesn't apply to me. You know what I mean? Like, as you said, one person, and I feel so overwhelmed when I bring it up, people telling me, you should have this injection, try this supplement, try this. And I feel like we get bombarded with advice, until I would love everyone with a chronic illness to first just be like, oh, thank you for sharing that, and leaving the advice piece, while I know it's well, coming from a good place. Sorry, I had to add that. Mary, could you share what do you wish people knew about individuals with a chronic illness?
Oh, I know what my needs are. Oftentimes, going to that point of people are saying, oh, here are all these things that have helped, blah, blah, blah. Or even sometimes when people, therapists or doctors, try to test you and say, well, what if you sat with it? What if you didn't do this? Or what if you did it differently? And when it comes to really that physical aspect, I know what my needs are. One quick example that I have is I have interstitial cystitis, also known as painful bladder syndrome. Basically, we joke all the time, my bladder got so stressed out it ate itself. So it's super painful. At the worst of it, I was using the restroom maybe 100, 150 times a day. And this peaked when I was in college, and my college roommates thought it was all in my head, was what they relayed to me, and would lock our communal bathroom door. They thought, because they believed it was in my head, it wasn't. And even if it was, you still deserve help and kindness, that locking the door would help to solve the problem. I have always known, from the onset of symptoms to today, being able to manage it much better, what my needs are. So I would want other people to know that, if you have a loved one or a family member, or even just as a term for yourself when asserting your own boundaries.
Amazing. Yeah, I love that. Emily Ellickson at 422 said, I wish people knew we were not lazy. We work hard and do our best, but we have limitations. We may not be as productive as you are, but we're not lazy. And I think that is a beautiful, addition to what you're saying there, is we have to be curious when we're talking to somebody with a chronic illness. So I love that. Thank you. How about you, Jessie? What do you wish people knew about chronic illness?
I feel like I can't stop nodding my head at Amy's comment. That was great. Along with what everyone's been saying, I think something important is that, like, even if you can't see it, it's very real. Similar to Mary, like, my friends never really believed, like, I kept going to doctor's appointments and never really had a diagnosis because they couldn't figure out what was going on. And since I didn't have that diagnosis, my friends were like, well, why do you keep going to doctors? Like, why don't you just like stop all the medication you're on and like just don't go to that doctor? And it's not like I was like just dying to go to all these doctors and like hang out in like the waiting rooms and all that stuff. It's not like a fun thing. But I so agree with what Amy was saying. Like, I'll have to take a lot of breaks or not be able to go on certain trips and stuff like that. And it can seem very much like, oh, I'm just being lazy, or I just like don't want to hang out with people. But it's more so the opposite.
Yeah. People like, we didn't sign up for this. This is not a list I wanted to be on, right? Yeah, someone said, so true, Amy, there's so much hidden labor that comes with living with OCD and other disabilities. How about you, Jake? Can you share what you wish people knew about individuals with chronic illness?
I'm actually struggling to find anything else because everyone else covered it so well. That's what I get for going lost. What I think I would want people to know is that there's a lot of conflicting information out there about like what it even means to be disabled, what it means to have a chronic illness, what it means to have like these specific diagnoses. And I guess I'm kind of echoing what Mary says, as far as like we're the experts of our own experience. The individual is what they've gone through for treatment, what they've gotten diagnosed with, kind of their whole lifestyle, what they need. So, if we say we need something, listen to us.
Yeah, I think it's true. I mean, even going back to the overlap between OCD and chronic illness, I think that the thing I'll add here is I want people with chronic illness to know that you also have to advocate like crazy with a chronic illness, as you do with OCD. Like we know the statistics with OCD, you've been bounced around for up to 14 years with no diagnosis, no correct treatment. The truth is that's for a lot of people with a chronic illness. It can, it does require you to sometimes show up in a big advocacy voice that isn't easy, and they're not easy conversations to have. And sometimes I think for people with OCD who are usually very sensitive and lovely individuals, it's hard for them to say like, you need to listen to me, right? Like I can't see you anymore if you're not going to listen. So I love that you guys are sharing. Someone said the OCD is totally invisible and hard to express to others to understand the state we are in. Absolutely. I think that's true for chronic illness. Interesting. So maybe, Mary, you might even want to speak to Elisa's comment at 4:26 California time. It said, I think the OCD made it very hard for me to feel like I really knew what my needs were. Could you speak to that?
Oh, absolutely. This is when, so I work with a lot of clients who come in that have both OCD and chronic illness. And one of the things that we typically do early on is we'll get 2 sheets of paper. One will be what I think the OCD is. I think that's the OCD. The other will be, I think this is the chronic illness. And then sometimes we'll put like a sticky note in the middle or something in the middle that goes, it could be either or neither. So sometimes we also have to do that with our needs, right? We have the hard yeses of this does make me feel better, even if it's a quick fix, or the hard no of this never works for me, right? And then we have to get comfortable sitting in that uncertainty with them to figure out, okay, what can we start to determine and narrow down as your needs?
Amazing. Thank you. I think that is so important. Absolutely. All right. So let's sort of move forward in terms of, I know, Jessie, and I'd like you to speak to this because you mentioned it before, is how does health anxiety complicate things when you have a disability or a chronic illness?
I'm so sorry. I just want to go back. I didn't want to interrupt you, but I just wanted to add to the point you were saying. I feel like you were saying before, you like can't resist. The point you were saying before about like having to be like a really strong advocate for yourself. I remember my mom and I like pretty recently would have these like hype each other up sessions where we're like, we're going to call them and we're going to demand this and we're going to, because we're such people pleasers and I like don't want to like offend anyone or say anything. And we're like, we're going to call and we're going to say like that we need this appointment. And then we would like finish and we're like, we're not going to do any of that, are we? No, we are. Like we had to like hype ourselves up. I I have a joke now that like no celebrity needs to hire a bodyguard. Like you just hire a receptionist from one of these places because you're never able to get in touch with the actual doctor. But your question was about health anxiety. So I'll answer the question about
No, I appreciate your additional point there because I think it is true. I think that you do need to get hyped up because it is so hard to advocate for some people. I mean, some people are like born advocates, but I am not one either.
My mom and I are not either. Yeah, we really had to try hard for that. But with health anxiety, what's really challenging is that like it's not all like with my other OCD themes. Like a big one for me is like burglaries, and is someone gonna like kidnap me? Where like I very well know that the likelihood of me getting kidnapped is like pretty slim, but the likelihood of me getting sick at this point in my life is pretty high. So that's pretty challenging because it's a little different from other types of OCD and like other themes I've experienced in the past. But it's just very challenging to know, as Mary was talking about, like parsing out one from the other, because I don't want to end up being compulsive and like talking to all these doctors when like it also can like the same thing can happen and it cannot be compulsive. So it can just be very difficult to tell which is which.
Right. Do you have a way in which you determine what is what?
Well, a lot of the OCD and health anxiety is very urgent. Like, I need to go to the ER right now. But the long waiting times have helped in me not wanting to go to the ER as often. I know Jake works in an ER, so he's laughing. But that's one thing that's been really helpful. And then also just like trying to let some time pass, like I said, with urgent care. I guess it's just all about urgency, no pun intended with urgent care.
Jake, do you have any feedback given where you're working and to sort of look at how does health anxiety complicate things?
So it's a great question. And I was laughing just because there are some pretty long wait times now because I mostly work on the weekends too. So, and that's, people come in on the weekends. It's an interesting overlap because you hardly ever see someone come in with health anxiety that don't already have some other diagnosis, right? Like, I mean, that's just something that I've noticed with my work, and I've only been there about 2 years, but typically if someone comes in and they're already very anxious and they're anxious specifically about a symptom, they've already been diagnosed with something, or they have something family related, like just family history of that disorder or disease, whatever it might be. And so then it turns into this piece of, okay, well, yes, they're having an anxiety response, but you can also have like a medical condition going on, kind of that both and versus that either or, that sometimes I think the medical model gets stuck on of like, well, there's typically one source for whatever's going on here. So we're just going to go with the more likely answer. And it's like, well, no, I mean, humans are more complicated than that. And we should be able to recognize that.
Right. I think, let's dive there a little deeper is, I actually did a whole podcast episode on this because for me, and this is just my personal experience, you will have a symptom that's a part of your chronic illness. I have postural orthostatic tachycardic syndrome. And then you have anxiety about the symptom, which can exacerbate the symptom, which increases your anxiety about the exacerbation of symptoms. And how would I possibly weed one out from the other? Now, I'm really lucky because I can walk into a doctor's office and they can see that I'm anxious, and I'm able to say, no, I'm an anxiety specialist. I know the difference. But a lot of people who aren't an anxiety specialist don't get that respect from the doctor or that authority from the doctor because they're not a therapist. And it's hard. How many people in the room have been told it's just your anxiety? Show of hands. Right. So I think that that's a really important piece when it comes to health anxiety, because there is that real build up on top of each other. Sandy, do you want to speak to that at all?
I actually wanted to mention, because in the comments I'm seeing a few sort of themes of feeling invisible, feeling invalidated. And so we as a SIG did a survey of all the SIG members a couple months ago now. And, the SIG members all had different things to say. But one of the things they all said was 100% of the SIG members said they either felt invalidated because of their OCD or because of their chronic illness and disability. And that was 100% of survey respondents. And everyone comes from very diverse backgrounds. But I think, there's a lot of feelings and like bad feelings around feeling like, your pain isn't seen, your suffering isn't seen. So I guess that's just what I wanted to bring up.
Yes, absolutely. Do you want to speak at all, Sandy, before I move on about the health anxiety component, or is that something that's not really, specific to your case?
I mean, for me, similarly to Jessie, I think it's really that urgency. So I guess for me, it's like trying to figure out, and this is a hard thing to parse, but it's like, is the urgency I'm feeling in my body, is it those physical symptoms that need treatment right away? Or is it more my mind? Is it more my OCD trying to get that sort of certainty that I can't really ever really get? So that works for me, but I know it's different for everyone. And so it's a hard thing to figure out.
Right. Yeah. And Mary, do you want to share either from your personal experience or as a clinician?
Ooh, I'll do both. Sometimes as clinicians, we have to sit in that uncertainty and that gray space with our clients. And that's hard. And we can sit in that space with them and recognize that, we don't know, just as I know my needs and I know my experience, I also have to remember that I'm not the expert on yours. So that if it is both one or the other or neither, we'll figure it out as we figure it out. I personally don't have a lot of health anxiety in the sense of I need to go to the doctors. Mine's actually opposite. Mine is every time I go to the doctors, they either imply or they say outright that I'm lying because I look very healthy. Two very recent examples because they happened at the same doctor's appointment. I suffered from a major motor vehicle accident where I had a really severe concussion, and it left me with this like inability to walk perfectly. I bump into things a lot and I trip a lot. My doctor had me walk 10 feet and goes, "Well, you look fine." It was 10 feet one time. So there's that. And also I was put on a medication, and I see in the chat there's some talk of SSRIs and how doctors will judge you based on that. I went on my SSNRI. It spiked my heart rate so bad that my Apple Watch was constantly telling me that my heart rate was like approaching 190. I told my doctor, he goes, "That's not true. You would feel terrible all the time." I already feel terrible all the time. So they took my heart rate in the office. Sitting down, just hanging out with them, it was 130. So if I'm up and about and I'm getting these readings, it took them having to do one of their own tests to take me seriously. Mm-hmm. They were much quicker to write me off as a patient altogether than to even perform the test that says, oh, maybe there is something going on here.
Right. Right. I thank you so much for sharing that. I think for me, I don't have what I would say is clinical levels of health anxiety. However, I will say I have a lesion in the back of my brain, and every 6 months I needed to get an MRI on that. And leading up to that MRI, I would have health anxiety, which I felt was appropriate, right? Like you're dreading that the lesion is growing. You're dreading the blood test that you just had. You're afraid of the outcomes because we already have a chronic illness. Anyone here can really weigh in here is, if you've already got an anxiety disorder and a chronic illness and you have valid test anxiety, has that been something that sort of increased your chronic illness symptoms or even your OCD symptoms? Does anyone want to share?
I'd love to weigh in here because I don't want to be the last person like Jake. But something that I've really experienced is, as I kind of explained, it took me a really long time, and I'm still kind of going through the diagnostic process and not really having that diagnosis, but they see on my chart, like, I have anxiety, I have OCD. It's much easier to say, like, oh, well, there's an answer. Like, she's clearly making it up. And not like that was verbally said so many times to me, but like I internalized it so much that it became such a part of my OCD that, I was convinced, like, or I was like having intrusive thoughts that, like, I'm making this up and why am I even going to these doctors? And then you have, the story with my friend saying, why are you going to so many doctors? Like, I hear it from all angles. So I'm starting to believe it myself too. And it's taken me a really long time. And I feel like I still have moments where I'm like, oh my God, did I just make that up? Because, like, I look very healthy and sometimes I have a really good day where I'm kind of more able to function. And then I'm like, wait, I totally made that up, but I don't. And so I was like dying for some of my tests to come back like positive of like something's going on. Just because of how much I was concerned that, this was my OCD and I was creating this whole like elaborate plan.
Right. Absolutely. I think that probably more people than not would really resonate with that. Sandy, do you want to share about your experience with this?
Yeah. So, recently I was just in the ER for my bowel condition. It was okay, but so it was funny because I said to my mom who was with me, and I said, like, I just want them to come back, and I wanted to show a bowel obstruction because that's what I get with my bowel condition. Because I want my reputation to be like a good patient reputation. I'm like that I know what I'm talking about. But it's like, why should I have to be a good patient? Like, that seems silly almost. But it's like, because I'm chronically ill and I want to be like, I just have sort of a people pleasing tendency. It's hard to not want to be like perfect in all aspects, including being chronically ill.
In at 441, Kira has said, yes, non-chronically ill people never understand the disappointment of negative test results. And that is so real, right? That most people would not understand and say, what, how could you be happy with a negative? But I think that they're, again, more common than you would think. Jake, do you want to weigh in?
Yeah, I have a couple thoughts. One thing that I kind of just wanted to name too, because I think it's coming up and we just haven't named it yet, is the gender disparity in healthcare. There is a very clear, and there's been multiple research studies about it, where men and women are just treated differently in healthcare. I have not really had the experience where I've gone in and someone has said, I don't believe you, or I don't think this is happening. I completely recognize that as part of my privilege. I think I've had like one experience when I was first diagnosed with MS. They said, oh, well, you have double vision. Well, you need to get a pair of glasses that'll fix that, versus like, oh, you should probably go see a neurologist. But I just wanted to name that because I think that's also another important piece here. But with the health anxiety piece, it's interesting with multiple sclerosis in particular. One of the top things that you see on like, how do you treat multiple sclerosis? Like at the top of almost every list, it says reduce your stress. And I'm like, okay, I mean, I can try to do that, but I also have OCD, which stresses me out most of the time. And we also are all living the human condition, which also stresses me out all the time. And it's one of those pieces of like, there is a big interplay on inflammation and stress and how that affects chronic illness. But it's like this piece of like, it almost has you like second guessing it again. Like, well, I've been doing all these things to like reduce my stress and try to like feel better, but I'm still having the symptoms. So is it maybe my OCD, or is it like, am I overthinking this? Is it, or also I was going to say in my case, since, I have that privilege of going in and getting believed a lot, I'll go into doctor's appointments and say like, well, I've been kind of having this symptom, but I'm not really sure what it is. And they'll say, oh, well, let's just send you to PT, or let's send you to this. And like, No, I was like trying to figure out if it was an actual symptom or not. Like I'm trying to get some clarity, but now you're just sending me off for treatment and I don't know what to think. So I guess just some thoughts there.
Jake, you gave me goosebumps bringing up the gender piece. Truly, thank you for saying that. I think that it was very validating for me. So thank you. Just from a personal level, I don't know if you guys felt the same, but I got full body goosebumps over that, because you don't even, I'd never even considered that before, even as a clinician, that wasn't the experience for, you know, men. And I'm glad you brought the research into it. So thank you so much for bringing that in. Mary, do you want to speak to the health anxiety piece or any piece that we've talked about?
Yeah, absolutely. Well, to your leading question into this really great discussion, does it exacerbate your OCD, your chronic illness? The answer for me is both. I always have that internal fear of, do they think I'm a liar? Do they not understand me? I've been like, my OCD loves to latch on to the fear of being misunderstood. And when you're searching hard for a diagnosis, or you're coming in and you're saying, hey, this is what my symptom profile matches, you know, that idea of, do I come across as seeking? Do I come across as, you know, wanting, you know, a specific diagnosis, when in reality, I just want to feel better. And my chronic pain will get worse with my stress. It also gets worse if I get too cold. So it's one of those things where the more stressed I am about other things in my life, the more pain that I'm going to be in, and the more painful symptoms I'm going to experience. And directly to Jake's point, I have had doctors treat me differently, both because I am a woman and because I'm young. So I come across as, I don't know what I'm talking about, and I come across as hysterical. I last fall developed really severe PCOS, as in the matter of 2 months, I gained a bunch of weight, I lost a bunch of hair, I gained a bunch of cystic acne, and I lost my menstrual cycle. And as a young woman, that was a lot to process. My doctor's response to that was, oh, well, we treat PCOS here with birth control. There were no other options given to me. It was just hormonal birth control. I then saw a doctor later, because this previous doctor said, it's just this that we'll fix it with. Well, none of my other symptoms went away. I was like, okay, great. This is not helping the problem. This other doctor said, we can put you on a medication that will cover all of that. And now all of the symptoms that I was concerned about with my PCOS have been answered in a twice daily pill that I have to take. But that wasn't given to me as my first option. My first option was hormonal birth control.
If I could add here too about the young piece, I think it's really challenging. And Jake, I'm so glad you and Mary both brought that up. But it is really challenging too when you're younger, so they don't quite believe you. I look very healthy, so it's not believed as much. But then you add the OCD on top of it, where I'm constantly questioning myself. So, for example, I've been tested for everything under the sun, like tuberculosis, like all these different things. And they thought I might have had Lyme disease. They're like, well, did you get bitten by a tick? And I was like, no. And then I was like, wait, did I? Like, I can convince myself anything. So I'm like, I don't think so. And they're like, wouldn't you know if you've been bitten by a tick? And I was like, yeah, no. It's so hard because the OCD plays into that, where you're like, then I just seem like this young, foolish person who doesn't really know what's happening with my own body.
Yeah, I think that beautifully brings us into the next question. I want to just bring up one comment that was made in there. Someone said, I suffer from white coat blood pressure because of my health anxiety. And I think that there is a degree of stress as soon as you do see the white coat, particularly if you've been around a lot of white coats or you've had not a lot of great experiences. So I think that is very true to what we're speaking about. So thanks for that comment, Valerie. Okay, so I want to move into the next question. Are there any misconceptions you see similar to OCD when we're talking about chronic illness or disability? Sandy, would you like to go first?
I think the biggest thing for me, the misconception about OCD that also carries over to chronic illness and disability, is that we're making it up or we're faking it. And, it doesn't really matter if your illness is in your mind or your body or a bit of both. Suffering and pain is suffering and pain. And, it should be really treated with gravity and dignity. And I guess that's sort of the biggest thing I'd like to get across for that question.
Yeah, thank you. How about you, Jake?
Misconceptions. I think one of the things that I see across both conditions is, and I thought someone had mentioned this in the chat earlier, of like kind of that sense of like almost you're lazy because you're not getting better. And it's like, I get that on the MS side too, of like, well, aren't you in treatment? Aren't you trying these things? Haven't you tried this diet yet? I think we talked about that earlier too, of like all this random advice that you get from external sources. And it's like, I mean, I'm doing the best I can right now. Like I'm doing all the things that I can, given everything else I have going on in my life. And so I think that carries out over for both, of just that sense of like, well, aren't you doing your ERP? Aren't you, doing the treatment? Aren't you trying to get better? And it's like, sure am, but that doesn't mean it doesn't still affect my daily life.
Yeah. Jessie.
Yeah, even just going off of that, I feel like there's some days it's like a roller coaster for me. Some days I'm really like almost back to my old self, and some days I like can barely get out of bed, and there's like it's very up and down, and I'll go into flares and get out of flares. And I think what's challenging is often my friends and family will be like, she's doing so much better, she's cured. And they'll be like, let's go do all this stuff, and I like can't, or I am concerned. We were talking before about like anxiety about the condition making it worse, because then I'll get anxious, like, well, a flare is gonna come up again. And then another thing I think that I had too until this happened to me was that like only old people are sick, right? Like 22, 23-year-olds, or however old a person might be, like I thought you had to either be like very like ill or you were like healthy. And I don't think I understood that there's this like gray space of like really kind of being both. And just like had no idea what that experience is like, that unfortunately I gained membership to. But yeah, just had absolutely no idea that like that even existed.
Absolutely. Mary.
I see a lot of overlap in the both of them with my need to plan ahead. One of my chronic illnesses, the interstitial cystitis, can be very embarrassing if we don't plan for a flare-up. So something that I do in my personal life that I teach all my chronically ill clients is to make an oh no kit, or funnier language if that is appropriate. I think we all know where I'm going with that one. But in your oh no kit, right? Like, yes, the OCD is probably saying like, okay, like this bad thing is going to happen, right? And we don't want to accommodate the OCD, but we also have to be realistic with the health and say, we might have a flare up. What do we need if we have a flare up? I'm going to keep a go bag in my car when I'm in public. God forbid I have a flare up, or if I'm with friends, or if I decide to do something fun, just to have that little safety thing. So in both the chronic illness and the OCD, I am always trying to be 3 steps ahead.
Amazing. The thing that came up for me was, I mean, as a clinician who treats OCD, so often clients come in and their previous therapists have said, just stop thinking about it, right? And I think that that's so true for chronic illness. Like, can't you just put your attention on, your hobbies, or, maybe, yes, you're in pain, but maybe don't think about the pain. I think that that's like a common way that people, it's again, sometimes coming from a place and maybe it's worked for them. It's, they're coming from a good place. But I do agree with you, Jessie. I think that there is a huge fear of relapse across both conditions. that most people probably wouldn't accept, consider that that's a concern. Excellent. All right, let's keep going. So we got super well said. We take cancer and seriously, but not OCD. Absolutely. And a lot of people are just validating all of what's being said. Sounds like we've got a lot of people who've had some like as Sandy said with the research that they did, some not so great medical experiences. And I think that's also because a lot of the time the doctors just don't know, right? They just don't. All right. Do you see stigma similarly represented with your chronic illness or disability as you do with mental health? A lot of what we're talking about here, particularly when it comes to disability pride, is to try and take away that stigma. We have OCD Week. It's wonderful. Let's talk about this. So how about you, Jake? Do you see stigma represented similarly between the two?
I do. And so, I think some of the stigma we've covered pretty well, as far as like sometimes it can just be so invisible. Because I know like my OCD when I was diagnosed at age 12 was much more behavioral than it is now. It's much more mental. Mm-hmm. And so people don't see the OCD necessarily unless, they're a loved one or a coworker that maybe knows you really well. And it's like, oh, well, Jake's doing this thing again, or this is happening. Then it's kind of seen. But that's also often the case with chronic illness and disability. Unless it's something obvious or it's something that is like already in their brain, as far as like, this is what a person with a disability looks like, or a person with chronic illness looks like. It's so hard to put that into the right frame of perspective. Specifically with like MS, I was going to say there's something specific about that. I might have to come back to that. But there's like with MS, we were talking earlier too about if you have a family member or someone that has like that specific diagnosis, then anything outside of what that presentation looks like doesn't match. And so then there's also like the whole stigma between like, well, if they knew someone that had the diagnosis and were much worse off or had much more severe symptoms or maybe even passed from that chronic illness, then all of a sudden they panic when you bring it up. And it's like, well, no, like I'm actually doing okay. Like I'm in a good spot with it, or however you want to self-identify. But there's that piece of like the disparity between the understanding. And I think that's where a lot of the stigma comes in.
Great. Thank you. And if you want to add something as we go, just jump on in. How about you, Mary? Would you like to share a little bit about the stigma and how they're similar between the two?
Yeah, I think a really great example is pop culture and TV. So I see a lot of stigma with, when characters are introduced on shows as having OCD or having chronic illness. There are maybe like 2 episodes on it, and then they go back to being completely able-bodied. Or they kill the character off. Or like I would just love one show where a character is chronically ill, openly chronically ill, and lives more than like the season, right? Or like with their mental health, that it's present, it's there, right? But it's still a fulfilled life. A lot of the stigma, goes into that secrecy of people don't really know about it. So when they do talk about it, their idea of talking about it is super limited.
Thank you. And Jessie?
Yeah, I actually have a bit of a different answer here. I feel like it's really different stigma. I mean, I think there's a lot of stigma for both. But personally, I felt so much more stigma for my mental health. Like I was diagnosed a lot earlier with OCD, but didn't tell anyone, barely talked about it with my family. I still don't even think my own brother knows I have OCD. Whereas from the get-go with chronic illness, I was like guns a-blazing, like, let's talk about this. This has like become my life. And I have had like, we joke about it, and where I worked, they like all knew about my colorectal surgery appointments because like I talked about it all the time. And like that's not like the most comfortable thing. Like, you know, people aren't like, how's the weather in your colorectal surgeon? Like, you know, it's not exactly the thing you hear all the time. But I was like happy to talk about it and like wanted to decrease the stigma. But then when it comes to my OCD, like now that's something I really feel passionate about. But I felt so much shame and like so much stigma just from a very young age. So I didn't even think I could talk about it. And I still find it a lot harder to talk about. And like, I think that's important to like it's something that I really care about. So like, it's something I do. But I still don't find it nearly as comfortable as talking about like any of my medical conditions.
Thank you. And Sandy?
Yeah, for me, I think I felt a lot of shame because of stigma for both my physical disability, my chronic illness that was sort of like physical, structural things in my bowel, but also like a lot of shame with my mental illnesses to the extent that I sort of hid my mental illnesses for years and years. And really only a few people knew that I sort of had something going on. Was it anxiety? Was it depression? They didn't know because I hid it so well because I felt like I had to be this perfect person and overcome this disability. And I think that's a lot to do with like media stereotypes about like, you know, you're either, you know, sort of pitiful and little and, oh, everyone feels sorry for you, or you're overcoming something big and awful. But I think like, I found a lot of freedom in talking more openly about both my disability and chronic illness, but also my OCD, and say, yeah, you know, I have all these things going on, but I still have a wonderful and fulfilling life. And it's okay that life is complex and life is hard because it can still be great.
Yeah. I'll just quickly bring up in terms of stigma, just in case someone here needs to hear it, is I want to just highlight the stigma of people in larger bodies and how that is so, it impacts medical care. We have a lot of research to show that, you know, there's some really beautiful books written about this, in that people who are in larger bodies don't get as good a care. We also know different races don't get as good medical care. They don't get considered as much. And I think that really adds to the stigma they feel when they're asking for medical help or mental health help. I think that it's important that we do address that, because there are layers upon layers of where stigma can happen here, particularly in different minorities, different body shapes, you know, all, you know, again, sexuality even. I think, I don't know the research on sexuality, but I probably would assume even depending, that may be a factor as well. And, you know, if we need more information, we can, you know, look into that for sure, because I'd love to make sure we get that right. So I think that stigma goes beyond these two categories into other categories that may be impacting us as well. I just wanted to bring that up because I feel like somebody in this room may need to hear that. Okay, so let's now talk about what, actually, no, let's change for 1 second. So what, for each of you, and you guys have answered this question already, but please do go a little deeper if you can. What are some of the more challenging parts of having both OCD and a chronic illness? Sandy, would you like to go first?
Sure. I think the most challenging part is that there's a lot of extra labor. And I think someone in the comments actually said this earlier, and I don't know when, but that sort of flagged in my mind that there's a lot of extra work that goes into being disabled, chronically ill, or having OCD, or, you know, another mental illness. And I think, you know, when you're often tired out because of these other conditions, that extra labor, whether it's, you know, calling all these doctors or scheduling tests or driving somewhere, you know, it can be a lot. So I just sort of wanted to acknowledge that that's really challenging. And I guess the other part is that for me, I know my OCD can often say things like, you know, it can't really be that bad. Like your suffering really isn't valid, and really not nice things. So I guess like the most challenging thing would be just like applying things like self-compassion and common humanity. Like that took me a really long time. You know, now I'm in my 30s, and, you know, I feel like I'm only just really learning how self-compassion is really changing my life and the way that I interact with myself on a daily basis, because I mean, at the end of the day, we're sort of with ourselves the most of anyone ever.
I love it. Mary, would you like to share what were the most challenging parts, or what are the most challenging parts for you having OCD and a chronic illness?
Oh, this is going to be really vulnerable. It's really lonely. It's really lonely. Just having to know what my care needs are and to follow through with my care plan often has me leaving get-togethers early, or only being able to participate, so much. It's very isolating, because you don't plan a flare-up of either the OCD or the chronic illness. And it's really hard sometimes to ask for help or to ask for patience. It's just really lonely.
I'm so grateful that you shared that. I mean, even the comments, people are saying right away that they agree. How about you, Jessie? Do you have something that you want to share in terms of, the challenge of having both?
I feel like a strong ditto to what Mary said. I think being on the younger side is really challenging with that too, because like I was in college when I got really sick. So like people are going out at night, like going to parties, or like you have 8 a.m. classes or stuff like that. And I just couldn't do it. Like a lot of things were really challenging. I think too, like no one that I know in my like personal life has OCD or like a chronic illness. Like it's not something that my friends necessarily relate to or even like can try to understand. And they do, they're great. It's just something that's really tough to get. I think what's hard too, um, oh my gosh, I'm totally brain fog is like one of my symptoms and it's coming at the worst time. Oh, that's actually what I was gonna say, is that it comes that worked out really well. Things like come at the worst times. Like my chronic illness will like make me do the worst exposures that I never wanted to do, but then are like forced to do. Like I would always like I have a lot of like people pleasing and like relationship obsessions like around my friends. And we had this trip planned. We were going to go to my friend's house in Colorado for like spring break, and I was all set to go, and then was in a flare and like couldn't go. And my OCD was like wild that week, because there they are having all this fun and the obsessions are so loud. And I'm like sitting there like, why am I so sick? Which then doesn't help being sick. So it's like forced me to like come at the worst times of like really exposing myself to something, or then also being in just like a really challenging place with chronic illness.
Yeah, thank you so much. Jake, would you like to share?
So I think like one of the things that comes up for me when we're talking about this is like the idea of, I feel like when you have both, you have to make a lot more compromise around just life in general. Definitely echo what everyone else is saying, but like the piece of like being social also, do I work full time? Depending on the illness, am I able to work full time? Am I able to work part time? Am I able to actually get to all my appointments if I'm working full time, because I have to ask for that time off? And then having OCD on top of it, for me personally, I was going to ask Mary about this too. Like, there's also kind of like the stigma piece around being a clinician with OCD, or being a clinician with any mental illness, right? And so like having to kind of have all of those balls in the air and having to juggle all of that at once can be a lot, especially if you're working full time to cover your insurance so that you can pay for your medical care. There's a lot of things relying on each other. And then all of a sudden it's like, oh, well, I haven't met with my friends in 6 months because I have to work and rest so that I can take care of myself. And that was the piece that had to be compromised.
I wonder if I'm going a little off track here, but I think it's right where we're at. Is I wonder, does anyone feel like they want to talk about the grief of having chronic illness and OCD? I think that we don't often slow down enough to actually acknowledge like there is a major grief process that happens with both. Yes, like again, let's even say you get an OCD diagnosis, you're overjoyed, finally you have a word to explain it, but there is a grief process with that. Having a chronic illness, you want the diagnosis so you know what you can get treatment, but there's a grief process that goes with having to manage this, and the doctors and the money and the finances and the time. Does anyone want to share about their experience with the grief of having both?
I have a few thoughts. So I know I've been disabled and chronically ill and probably had OCD my whole life, although it wasn't diagnosed till a bit later. But so I've lived my whole life in this body that, works a little differently than the average body. But, sometimes I wonder, what would my life be like? Who would I be if I didn't have all these challenges? And, would I have been better? Would I have been different? Like, would my life be cooler? So I think there's a lot of grief in the still moments, and just that idea that somehow I'm missing out on being this ideal version of myself, or having the best life possible, even if such a thing doesn't exist, because of all the chronic illness and the mental illness and the disability.
Does anyone else want to weigh in?
I've recently experienced some grief in the sense of I used to play a lot of sports, and that was one of my big activities and hobbies, and I just kind of can't do it anymore. And I feel really grateful that I was able to play sports in high school and have that experience. And I'm so glad that I had that experience. But it's really challenging now that I can't really do that. Or my family is on vacation right now visiting my brother, and we're have all these plans to do all this stuff, and I'm trying to explain to them I can't really do that anymore. I know I'm the same person, but I can't just go from activity to activity. And it's really tough because I know what I could do before, and now I know I can't do it. So even swimming in our pool, I would get tired walking down the 3 steps we have, and I was oh my god, I used to run around this pool as a kid, and that's been very challenging to see.
Anyone else want to share?
The grief process is constant. I think I'm always mourning the little parts that I see that I could be. I know if is a really big word in the OCD community that, we try to stay away from, those what ifs, but it is something that comes up in the realm of my chronic illnesses and how they've impacted me. But I'm also a big believer in the statement that grief is just love with nowhere to go. So when I'm having those moments of grief, yes, I make space for it, but then I figure out, okay, where's that love underneath, and where do I want to let it go?
That's really beautiful. Jake, do you want to weigh in, or will we move to the next question?
I'll just add quickly, I think one of the things too with the grief and loss process of having both OCD and a chronic illness is how kind of they interplay on each other too. I was just thinking about when people were talking about being social and things like that, there was a horrible social anxiety piece that I had growing up with OCD that was just part of it. And then I got into my 20s and I started to get a lot better, and I was socializing more, hanging out with more people. And then I got hit with the MS diagnosis, which a couple of the things about that is the fatigue one is huge. And then the second piece is heat intolerance. Anytime there's really hot temperatures, or you're doing anything exercise related, anything like that makes it very difficult, makes symptoms flare. So now I live in Colorado, and I have friends that hike or go rock climbing or do all these other things. And they're hey, Jake, you want to go? And it's well, what's the temperature going to be outside? Or, can we go hang out somewhere where it's air conditioned instead? Or, Colorado is huge for it has a big brewery culture too. So everyone hangs out at all these little breweries, and it's well, I can't really drink alcohol because it doesn't impact me very well. And they're all outside in the sun, so I'm not going to do that. There's lots of ways that they kind of interplay off of each other. And that grief of like, oh, well, I could have been social when I was younger, when I didn't have the diagnosis yet. Now I can't in the same way, but I just have to figure out some alternative ways to do it.
Yeah, I love that. I think that the grief process is true, but I love how you're speaking to making sure that you still, have those connections and so forth. Thank you. Somebody asked in the question in the chat at 509, Amy, is there a chronic illness, disability, OCD combination support group? Do any of you quickly want to share any resources that you know of to help with this?
Well, I'll just quickly say that we have the special interest group that we started. And I will say too, I think it's pretty cool that we have like over 100 people signed up on the list. Like, while we think, I mean, my parents always tell me that's so niche, Jessie, like no one's going to sign up for that. But like, it's not as niche as we think. And as we've heard, like there's so much overlap. Oh, thank you. They're so good. They got it in the chat. But there really are a lot of people. And I think what's cool too is that we all have such different diagnoses, other than OCD, and we all have such similar experiences. So it's really neat to be around people because a lot of us don't have people in our personal lives who go through these same experiences.
Yeah, and I will vouch for the SIG. It is the most beautiful, inclusive group. If you're feeling lonely, I definitely would encourage you to prioritize getting in that SIG. It's incredible. Okay, we have a little bit of time. I have one more question, and I think it's a really important one. How can clinicians, and this is you guys in terms of giving advice, better support their clients with both conditions? Let's see, Mary.
Oh boy. This is my special interest within the special interest. First thing is to listen. Be curious. Kim, I think you said that earlier in this talk tonight, is to approach things with curiosity. You can better support all of your patients that come to you if you don't automatically put them in the same boxes that everybody else is putting them in.
Amazing, yeah.
Oh, yep, go for it.
No, keep going.
Oh, okay. And practice what we preach. A lot of us practice ACT along with ERP, and to sit in that nuanced space with them. Sometimes all you can do is symptom management, and that is okay. We don't always need to have a goal.
Right. I love it. Someone said, please, as for the clinicians, please do not assume I'm not trying hard enough with my ERP just because I advocate for workplace accommodations. Very, very true. I love that. How about you, Sandy? Do you have any advice for how clinicians can support their clients better?
Yeah, I think for the ERP clinicians, like, we understand that you are the expert in OCD and we respect that a lot, but we as chronically ill and disabled people are the expert in our own particular lived experience. So just holding space for that experience and the complexities that comes with being human. And I guess the other thing is just to allow there to be days where there's like just rest, maybe not ERP 24/7, because sometimes we can't do that. And that's okay to move at a slower pace. We will get there, but it might just take a little bit of creativity and flexibility.
Yes, I love that. Jessie.
I'd say the best thing, well, first I'd say validation, because as we were talking about with our research and the poll and everything, it's just really hard. And it's really nice to hear sometimes, like, yeah, this sucks. This is really hard. I think too, like, the best thing that I've heard from whether it's my own therapist or the like doctors I've been to is when they're like, yeah, I don't know. When they're like, yeah, like, this is confusing and I see why you're confused. Like, I'm not sure. Like, maybe this is your OCD. Maybe it's chronic illness. Maybe we don't have to figure it out right now. And even doctors saying like, yeah, I just don't know, but I'm like willing to like look into this and like work through this with you. I remember one of the doctors said that recently, and my mom and I were looking at each other like, oh my God, like we love him. So that's been very, very cool in my own treatment.
How about you, Jake?
Two thoughts. One that popped into my head is just the concept of on the client side and the clinician side of being okay with both. And like, it's possible that my OCD is flared up and I'm really anxious about something. It's also 100% positive or possible that my symptoms are flaring up. And I can acknowledge both of those things without it being a barrier. I think there's always kind of this piece of fighting back and forth of, okay, well, but is it the OCD? Like it has to be one thing. We have to pick one and then we're going to go with that. It can be both, and that's okay. The other piece I wanted to share too is like with clinicians, specifically working with OCD and chronic illness, is the kind of the accommodation question that I think we kind of answered, we talked about at the beginning, and Kelly brought up in the chat of, there is a space for pulling back on the ERP. We don't have to go 110% all the time on ERP. If you can do it, great. If you can't do it and you need some accommodations at work or at school, whatever it might be, just to be able to make it through and to actually also afford treatment by being able to work full time, then that's what you need. And both of those things can be okay.
You're muted, Kimberly.
Sorry. What if I can add one thing here, and I'll add this as a point because I've made this mistake. I'm always happy to tell you that I've made my own mistakes. It's so important for clinicians to collaborate with medical professionals. I've had so many clients with chronic illness, and the ones where I end up doing not a disservice to them, but not showing up as well as I could is because I didn't collaborate with their medical professionals and I've missed something, or I didn't understand the actual medical side of it, or I made an assumption about their condition without actually educating myself beyond Google or whatever. And so I think that the collaboration piece is really important. And you can also do that in terms of educating the doctor on maybe areas that their OCD are attacking. Little one thing to think about that is we don't also want the doctor now like withholding all information because they have assumed that's all compulsive either. So these are sort of nuanced conversations that we have to keep having. And I bring that up because it is an error I personally have made as a clinician that I promised myself I wouldn't make again. And so that's my personal piece of advice. We have a tiny bit of time just to close out, and then I'm going to read out some announcements. Before we finish up, number one, this has just been so fulfilling for me to host. Thank you so much. Would you guys be able to share just like a last piece of information, something you want everyone to know, a piece of hope? It could be you could sing a karaoke tune if you want to, whatever floats your boat. Let's see. Let's go with Mary first.
So the thing that immediately came to my mind was I believe you. Whether or not you fully understand it or can verbalize it, and if it's different every day of the week, I believe you. That's my closing thought.
I love that. Okay, Sandy.
I think that my closing thought would be that life is hard and messy and challenging, but can also be beautiful. And it can be all those things at the same time. And there really is so much hope for a wonderful life, with diagnosis or, with multiple diagnoses. There's so much hope and there's people who want to support you. So look for the helpers.
Jessie, closing statements.
I love that. I would just add too, yeah, it's very challenging, but also ERP has helped me a lot with my chronic illness. It's not like it will only help with your OCD. And then also just with what Sandy was saying, there are helpers and there are people disability has sucked so much, but I've met these amazing people, and there is goodness that comes from very challenging times.
And Jake.
I'm going last again. This is great.
Sorry, Jake. I promise I'll do better next time.
No, not your fault at all, but someone has to be last, so I'm happy to be last. I would just echo what everyone else has been saying, and yeah, listen to these three that are all on the panel with me. They have all great advice, so go with that.
Yeah, I will. I'm going to read you some closing announcements, but what I will say personally is I truly think that you four are modeling so beautifully how to courageously and bravely live your life with OCD and a chronic illness, that this is no easy feat. This is a massive accomplishment that you can show up and advocate and share and be open and honest. So I'm just so grateful for you. I see you guys as like something to like look up to and something to try and achieve. So thank you all so much for being here. It truly is an honor to see this amazing, day, but also the SIG that you guys have put so much energy into. All right, so thank you so much. I'm going to read off the last piece here. Stay here with me, guys, because this is important. We have some announcements from the IOCDF. So walks are taking place across the country. Visit the iocdf.org/walk to find a walk near you. That's usually around OCD Awareness Week, so keep an eye out for that. The online OCD conference registration is now open. So you can visit onlineocdconference.org to register. This year's online OCD conference will feature 2 days of virtual programming for the entire OCD and related disorders community. I thoroughly encourage you to do that, particularly if you have a chronic illness, because you can do it in your PJs at home. It's totally the best way to do a conference. We have some upcoming streams that we would love you to join. On Wednesday, the 26th of July, we have a lunch and learn at 12 p.m. That is for 60 minutes. We have Thursday, the 27th of July, which is today, I think. Yes, this is a little bit old. Forgive me. We have an IG takeover. Actually, all of these streams have actually happened, so I'm going to skip that. On closing, forgive me, I'm just reading what I'm told to read. On closing, this live stream is one of many. You can see the entire schedule of future streams at iocdf.org/peace of mind. You can also view recordings of past live streams as well as watch our hosts answer your pre-submitted questions, OCD Mailbag, on IOCDF's YouTube channel. And you can get that by going to youtube.com/IOCDF. Remember to like and subscribe to get notified when live streams are scheduled. And if you need any resources at all, please visit the iocdf.org. And thank you again. We're 3 minutes early, but I'm going to say thank you so much. It has been a pleasure. Thank you for letting me host my very first town hall. I'm so grateful for you all for being here.